Hi, how are you?
It's about delivering a comfortable place for patients to be. They need to have a very accurate diagnosis when they come in, but I think I can do that with a smile and do that and make them comfortable at the same time. Hi, I'm Dr. Michele Perez. I'm a non-surgical spine specialist, also known as physiatry. The biggest part of spine care for me is to allay fears. That is one of the injuries that scares people the most, is neck and back injuries. They're just scared that they're going to be injured forever, and they've seen people that have had lifelong injuries. I think I do a really good job of helping them understand what their injury is. Is there going to be an end to it? Is there an end in sight? They really leave here with an arsenal of information and a plan, and that helps these patients a lot to not leave here with as much fear as they came in with. Another big thing with patients is that they often will say about doctors' visits these days that they've never seen for more than a couple of minutes. The doctors are in and out of the room, they didn't touch me, they hardly talked to me, they stood up the whole time. I mean, I'm sometimes in the room for, quite a long time with them. I'm sitting, I'm talking, examining them, and they're happy that I've spent a long time with them. Sometimes I see the light bulb go off in their head, and that's huge for me when they finally get it. I was born and raised in New Orleans, Louisiana. Spent almost all my life there. I studied undergrad at University of New Orleans, then went on to medical school at Louisiana State University. I did my physical medicine and rehabilitation residency at Emory, and we've been here ever since. Growing up, I was a dancer and gymnast from the time I was about 5 years old. I spent 6 days a week training and competing, and so from a discipline standpoint, it was a major role in my life. We certainly had, a lot of musculoskeletal things going on in gymnastics. So I think that probably played some into my general orthopedic interests. In taking care of patients, they see that I work so hard in figuring out what's wrong with them, because they actually say, well, nobody's ever really told me what's wrong with me. Patients are very scared of spine surgery, so the term non-surgical spine physician gets them here. I will exhaust all their non-surgical options. And the surgeons here know that if they do end up in their office, that I've exhausted all those options. When a patient should come in with back or neck pain, if they are self-treating at home with things like over-the-counter medications, Advil, Tylenol, ice, heat, relative rest, and their pain's still going on after about 4 to 6 weeks, they should probably seek out care, because most things are going to resolve themselves after 4 to 6 weeks if it's not serious. There are some things that might be worrisome signs that patients might need to come in sooner. If they're having fever, if they're having pain at nighttime, if they're having weakness in their extremity, an arm or a leg, they can't feel the extremity very well, or they can't move the extremity very well, that might be a sign of more serious condition. In spine care, the spine is slower to heal. If you have herniated discs or some type of arthritis, sometimes you get smaller steps, but they turn the corner over 6 months. It's a slow turnaround. It's a big turnaround from them, because they might have had pain for 20 years, and they tell you the little story that, oh, I couldn't do this last time I saw you, and I can do this now. So those little things, they're huge for them and for me.